You saw Texas and Florida, the governors there, really resistant to rolling back some of the openings that they've done. But now the governor of Texas has closed the bars, is closing bars. You see the same thing in 7 counties, I think, in California. And in Florida, they're closing some beaches for the 4th of July. It may be late, but is it enough at this point?
If they have pervasive community spread, if they're entering exponential growth, it's not going to be strong enough, unfortunately, and it's too incremental. They're going to need to do more dramatic things to get ahead of this. You talk to people, you talk to the doctors down in Florida and the Houston region. There's long testing lines. People can't get tested again. It sounds like a New York type situation unfolding down there. So it's going to be difficult for them to get control of it at this point. For every infection that they're diagnosing, there's at least 10 or 15 infections behind it. So they have tens of thousands of infections down there that are circulating in the communities right now. And that's what's going to be difficult. So, at the end of the day, we talk about the vaccine. I think we will have a vaccine in early 2021. That's where I talk about the 6 months. There's a lot of progress on that that's been publicly reported. But right now, the doubling times every 40 days, that's going to come down. By the time we get to the end of this year, probably close to half the population will have had coronavirus. And that's if we just stay on our current rate. So we don't need to vaccinate the entire population because a lot of people will have already had this by the time we get to a vaccination.
Scott, that's what I wanted to ask you about, and specifically not just the 6-month timeline, but also the comments that Dr. Fauci made over the weekend about the 70 to 75% effectiveness rate that he imagined something like this would be, at least early on. Talked about a couple of other efforts not related to COVID that finally got up there in the 90s, but that early on you're going to be much lower. And that also his expectation is that at least in the initial stages, much of the country won't actually take the vaccine. What do you think of that?
Well, it might be lower than 75%, and that's not necessarily a bad thing. If you look at the flu vaccine isn't 75% effective many seasons. It's partially effective. What it prevents you from getting is flu pneumonia. You could still get infected with the flu, and the COVID vaccine is probably likely to work in a similar way in that if you get vaccinated for COVID, you're less likely to get COVID disease, but you can still get infected with COVID. We won't need more than 40% of the population to get vaccinated for the COVID disease. Right now, only about 40% of people take the flu vaccine each year because we're going to have a lot of people who have already had coronavirus by the time that we get the vaccine. So to get to herd immunity, we won't need to vaccinate 80, 90% of the population or even 60% of the population. We'll probably only need to vaccinate 30% of the population, again, because a lot of people have had it. Probably about 7% have had it already right now. If we just continue on our current rate, at least 15% will have it by the end of the summer. If we just continue where we are right now, we get control of these outbreaks in the South. So we're going to slowly burn our way towards herd immunity as we get into the fall and the winter. The challenge is going to be the fall when flu starts circulating and people have the flu, and then you're testing for COVID for people who have the flu as well. It's going to exhaust our systems, and we're going to have a difficult fall. That's why it's very important, I think, to get vaccinated for the flu early so we can cut flu incidence and have more sensitivity on our identification of COVID going into the fall.
You think kids will go back to school in the fall?
I think in the Northeast, if we can keep things similar to where they are right now, yes. I think in the South and the Southeast where they're having these kinds of outbreaks, there's nothing that is very clear about what the backstop is. I don't understand what they're doing or what they're willing to do that's really going to dramatically cut the level of spread that they're having. And so that if they take something close to this level of spread into August, and school districts need to make the decisions in August, I think local districts acting independently are going to be hard-pressed to open the schools. So that's the challenge they face, and I think that's what they should be thinking about. It's not just a matter of keeping the bars and the restaurants and the tattoo parlors and the rodeos open. It's a question of trying to get the infection rate down so that they can open the schools. That is a gating factor to getting back to a healthy economy, trying to get the children back into the schools. They need to be focused on that as a policy action that they have to take.
Hey, Scott, I was at the beach this weekend. I didn't see a single person wearing a mask, and there were a lot of people there. What makes you think that we're going to be at this same level of in the Northeast, the same level of caseload when you have the businesses that are just reopening, hair salons, nail parlors? Restaurants are going to be reopening again. What makes you think that it's not going to come back here the way it is popping up there?
I think it probably will, but it's probably going to happen sometime in the fall, heading into the fall. So I think we'll be able to make the decision to open schools in August. What's happening in states like Texas and Florida and Georgia right now, that took 4 to 6 weeks to build. Time for introduction to epidemics, about 10 weeks. They had a lot of infection down there already, but these would change the transmission that took weeks and weeks to build into the kinds of caseloads that they're seeing right now. We're going to have the same thing here. Eventually, we're going to have change of transmission that build into broader outbreaks in the Northeast. We do have better testing, better tracking and tracing in place. So that's going to put downward pressure on it. And we have a population that's wary and is generally taking more precautions. So that's going to put downward pressure on it. But eventually, cases will build here. Hopefully, we'll be able to put out those chains of transmission. But I think as we get into the real depth of the fall and the winter and it starts to collide with flu season, it's going to get much more difficult. But this takes a long time to build. This doesn't happen in a couple of weeks. What's happening in those states down there took a month or more to build into the kinds of infection rates that they're seeing right now.